disease is something that we see very commonly among women. And one of the big reasons why we see this so commonly in women is the hormone connection to our thyroid. So our sex hormones can be so closely connected to what's happening with the thyroid and vice versa. And they kind of feed off of each other. And so this is why I see it so often in my practice and women that reach out to me, why they're having all these hormone disruption and thyroid disruption back and forth, and they're kind of feeding off of each other. So I wanted to share with you a couple reasons how we can see this happening, the connections and things like that. So one thing to keep in mind is that our thyroid hormones influence pretty much every system in the body. And so when it comes to our sex hormones, you're going to see a massive influence there. So it can actually influence what your menstrual cycle is doing, how often you bleed, how heavy the bleeding is. If your thyroid is either underactive or even overactive, can do this. Your periods could get longer, they can get shorter, they can get much heavier, even lighter, and you might just be kind of all over the place and have irregular periods. You might even stop menstruating, and I see this actually when women have something like hyperthyroid, where they're overactive. But more commonly, what I see in my practice and women that reach out to me is hypothyroidism. And this always really can feed into what our periods are doing. And this is actually a test that I do. I do a test that's called Dutch, which is a dried urine test. And it looks at all your sex hormones, but not just the sex hormones, the pathways for them. So I actually see some disconnect with how your hormones are actually being produced, but also how they're breaking down. And if we have an underactive thyroid, you can have a really massive impact on how your cycle will appear, how heavy it is, the length of it, if you even have a period, for that matter. So that's why it's really important to assess the thyroid in conjunction with sex hormones if you're having issues with your periods. Now, I also wanted to talk a little bit about fertility and conception. When we have an out of balance thyroid, it can really impact and interfere with your ability to get pregnant. And just like I mentioned, if your period's irregular, you're not having a super normal period, that means ovulation's probably going to be off as well. And so that's why a lot of women will have a hard time getting pregnant, because they're not even ovulating correctly or ovulating at all because the thyroid is so underactive. Keep in mind, when our thyroid is underactive, your body actually will put you into protection. It's going to tell you, look, our thyroid's not working right. We don't have enough thyroid hormone. We don't want you to get pregnant right now. And so it's going to protect you. And so it's not going to let you ovulate. It's not going to let you have a normal cycle and things like that. So because it's altering your menstrual cycle, obviously, that's going to drastically impact how you ovulate. And so some people, women that have come to me also, they start feeling like they're almost having menopausal symptoms when they're trying to get pregnant. And that's because the hormones are just so dysregulated because the thyroid is impacting it. Also with pregnancy, I wanted to mention a little bit more about pregnancy, once you are actually pregnant, how it can impact. Women with thyroid disorders actually have a really high risk. They have a greater risk of experiencing pregnancy complications. While they're pregnant, they can have a lot more issues, in other words, with their pregnancy. So that could be, miscarriages, preeclampsia. I see this really commonly. Problems with the placenta, preterm birth, even postpartum issues as well, where they have a lot of issues with bleeding and things like that. That's why it's also very important pre-pregnancy is to make sure that we have our thyroid under control. If you know that you're trying to get pregnant, and then during pregnancy, monitor those thyroid markers. I really, really encourage you to monitor thyroid markers during a pregnancy, whether you have a diagnosed thyroid condition or not, because a lot of women will actually end up having thyroid issues during pregnancy and they never had it before. So this is why it's really important to monitor that. And then of course, let's talk a little bit about menopause. So menopause can affect our thyroid function, and a thyroid condition can actually impact menopause. So when we have an underactive thyroid that's not really under control, it can dramatically impact how you go through menopause. I've seen so many women that I've worked with that have had a really hard time dealing with menopause because their thyroid was so wonky and all over the place. And had they had their thyroid condition under control a little bit better, at least, a lot of times they end up not having this drastic impact on menopause. They can actually get through it much easier. And so this, uncontrolled thyroid disease can cause stress just across the hormone system in general. It can stress out the body, but it can stress out, your hormone systems, and that will cause a decrease in the levels of progesterone, which that can dramatically affect, a woman going into menopause, being perimenopausal. When we don't have progesterone, you usually end up having quite a bit of symptoms, and they can overlap. It can look like it's a thyroid disorder or it's just sex hormone disorder, and we're going into menopause. You can have both at the same time, and it's not easy to manage. So again, that's why I always suggest really monitor those thyroid markers as much as you can as a woman, at least once a year if you don't have a thyroid condition at all and not diagnosed, to keep monitoring them, especially as you're approaching perimenopause, age or menopause. Definitely start monitoring them as well, because it will dramatically affect how you go through menopause. It will make it so much easier to manage menopause if we have good levels of progesterone, but we also have our thyroid condition under control as well. So let me know if you have any more questions about this. If you want more information as well on the Dutch test, my absolute favorite test to look at sex hormones and how the pathways work, send me a message, drop a comment below, and I can get you more information on that. I will see you on the next video. Bye.